Hello! In this video, we'll talk about some things we've learned about COVID-19 and how to keep every member of the SSP community safe as we return to overnight programs. These safety plans were developed by SSP's Medical Advisory Council, 5 healthcare professionals familiar with SSP's programs. Each safety measure is an act of service to our partner communities. Thank you.
Hello all, my name is Katie Strong. I attended SSP as a youth for 5 summers as a volunteer and also served on staff and maybe met some of you during the years of 2017, 2018, and 2019.
Hi, my name is Kelly Schreiber. I'm a board member with SSP.
Hi everyone, my name is Sophia Lariva. I was on summer staff in Chiloquin.
Hello, I'm Dave Herbert. I'm a physician specializing in infectious diseases, and I've been helping SSP develop ways to keep our volunteers, staff, and community safe in this time of COVID.
Here's a brief overview of what we will cover in this video. Vaccination, testing, and quality masking, being outside and volunteer cohorts, hygiene, as well as our response plan to positive cases. We'll talk about all of these things in more detail, but thank you for joining us.
I know that most of us feel that we're just done with COVID, but it is clear that COVID is not done with us, as infections are once again increasing. One of the most important ways we can protect one another from COVID-19 is through vaccination. While we know that vaccination does not completely prevent COVID, it markedly decreases the risk of getting infected, as well as the risk of passing along an infection if you are infected. And of course, it dramatically reduces the chance of serious illness if you do become infected. Since the SSP program inherently includes communal living and interaction among people from many different regions, it is important for us to add as many layers of protection as possible to prevent the spread of this virus. And vaccines are our first line of defense. This especially protects SSP's partner communities, which are historically medically underserved and therefore at higher risk if an outbreak occurs. So to make the SSP service trip as safe as possible, we require full vaccination, including boosters as eligible for everyone. This means being fully vaccinated with 2 doses of the Moderna or Pfizer vaccines, or 1 dose of the Johnson & Johnson vaccination, plus boosters as eligible. Since our program is voluntary, we are unable to consider any exceptions since they would place people at increased risk. Thank you and have a great trip.
This summer, we're going to mask up anytime we're in enclosed indoor spaces with people who aren't in our cohort. That means places like kitchens, shared bathrooms, and any indoor community spaces are all going to be masked areas. We also know that really wearing high quality masks makes a big difference. Those are masks like an N95 or like a KN94-95 mask. These have extra layers and filters that really help stop the spread of coronavirus and help protect us and the community that we're serving. We also know that if you have a mask, that's not enough. You got to wear it the right way. So we're also going to make sure everyone is covering their nose fully and has a really good seal with their mask around their face. Masks are not going to be required when you're in outdoor spaces where you can maintain physical distance with other people, or when spending time indoors with only your cohort. So that's in spaces like wherever you're sleeping and your vehicles. SSP is going to provide 2 masks for every volunteer for every day as needed. But if you have a favorite brand of mask that you want to bring with you, you're welcome to do so long as it's as good or better than the N95s or KN95s that SSP is requiring.
Another way we can prevent the spread of the virus is thorough testing. This is why we require all volunteers to provide a proof of a negative COVID test upon arrival. Both rapid at-home testing and PCR lab testing work. Be mindful of your exposure between testing and arrival. If you feel sick, please stay home, even if you have a negative test. When you arrive, the first thing staff will do is verify each person's negative results with the group leader. Staff will also test everyone 48 hours after arrival and as needed throughout the week. SSP will provide and coordinate all midweek testing, so don't worry about bringing tests with you.
This year, we'll do everything outside as much as possible. All home repair projects will be outdoors to protect the safety of residents and volunteers. We will also eat meals, sing, and do evening program outdoors. See our packing list to make sure you're bringing the right gear and clothes for the weather. Volunteers also have the option to tent camp outdoors at any SSP site.
Cohorting is an important precaution to decrease the impact on the broader community in the event of a positive case. Cohorting will mean that volunteers will stay in their same arrival group, vehicle, work team, and sleeping space. Cabins, tents, and dorm rooms will be shared by cohort. These will have improved ventilation. We will also cohort when eating, when distancing is not possible, and stagger shower times by cohort. In the event someone tests positive, it will be unlikely that they will have spread the virus to other cohorts. Now, we understand this is an adjustment to how we normally mix groups at SSP, so we thank you for your flexibility.
Of course, being safety conscious also means having good hygiene. SSP settings may be rustic, but we have tools to help volunteers and staff do this well. SSP is increasing the availability of hand sanitizer and hand washing stations and uses gloves when serving food. We will also continue our practices of using soapy water to clean, followed by a bleach solution to sanitize the surfaces. Opportunities to serve, which cohorts rotate through, involving daily cleaning and sanitization of the kitchen, tables, restrooms, and high-touch surfaces.
We know that in spite of our best efforts, there is always the possibility of a positive COVID case at SSP programs. In the event someone becomes symptomatic or tests positive, that person will isolate, and others who meet high-risk exposure criteria will also be tested and increase mask usage within their cohort to prevent additional spread. Those who test positive have two options: one, isolating on site for the duration of the week, or two, departing from site to travel home. Especially for those with symptoms, SSP does encourage departure from site. If you test positive within 48 hours of departing SSP site, please notify us so that we can identify other potentially exposed volunteers. All this to say, you have your support from this Medical Advisory Council, and all of these measures have been developed with the intention of decreasing risk to keep everyone safe.
Now that we've gone over SSP's safety plan, we hope you feel more prepared to serve with us. You can read more details in SSP's written materials and can always reach out directly with any questions. The Medical Advisory Council will also make themselves available as we navigate a new way of being together in person. Thank you for prioritizing safety. We can't wait to serve with you.